Voices for Healthy Kids has been changing lives for a decade. Our equity efforts have evolved from building more diverse advocacy coalitions to embedding equity within policies, to funding campaigns led by organizations that center communities most impacted by racism and other forms of oppression. Where we are today would have been inconceivable in 2013, and we are excited to imagine what the next 10 years of thoughtful disruption will bring.
If we're too nervous to say that our best intentions are not necessarily meeting the needs of the communities that we serve, then the culture as a whole doesn't necessarily have leadership that is pushing them to also innovate and experiment and be curious about those things.
Our responsibility is to eliminate systemic racism and health inequities that have happened in this country. And the sad thing is that these systems have been put in place which exacerbate inequities.
We know that solving these systemic issues takes more than goodwill and quick fixes. Instead, we must have open, vulnerable conversations with the communities that have been most impacted.
One of the things that we've done is worked very diligently around looking at the data and building relationships with more local and community-based organizations who can give us more insight into what is happening at the local level in the communities.
We have a great group of research advisors that have really challenged us to see our blind spots in this work. It's called our Equity-Focused Policy Research Advisory Group, and these are researchers who are equity experts. The type of research that we would hold up as the gold standard is not always the gold standard, so it doesn't necessarily have to be hard data or a randomized clinical trial. That stories, lived experience, qualitative information that you can get from a community conversation is research too.
Can we challenge the way that we look at data, that our data is not confirming that there's a problem, but our data is actually just reaffirming what communities have been saying for generations, which would actually then make the communities the scientists.
When a Black person says that they have experienced racism, believe them. Don't question it, don't rationalize it, don't wonder what that situation was, don't try to unpack it, fix it, reframe it in your mind. When you just believe it, it puts the work and the relationship in a completely different space.
I think we have to see the work that we do not as linear, but as a circle because it repeats itself. And I think about being okay with making mistakes, but admitting to that and being able to continue the work and learn from the work that you've done previously or the work of others, and how we can just continue to evaluate and rework everything.
Voices for Healthy Kids is evolving to improve the flow of funding to communities facing the greatest inequities, and to work with community leaders and organizations that are already making strides for change. By trusting, supporting, and investing in the people and places experiencing the greatest inequities, we can help remove barriers that stand in the way of healthy, thriving children and families everywhere.
They got to know your heart, you got to know their hearts, and when you know each other's heart, you're more likely to give each other grace. You always start off acting with care. When you're someone coming from outside a community, and you're trying to engage that community to do something where they are the ones that are going to carry the consequences of that. You don't have to be perfect from the beginning, but what you do have to have before you make any asks of anybody is trust.
Building that trust to let us in a real way, that's where the real power is going to come in.